Hey everyone, welcome back to another video. In today's video, I'm going to talk more about emergency room nursing and kind of describe how the emergency department works and what are the different places that an emergency nurse can work in a hospital. So the emergency department is very different than any other floor you work on in the hospital. It is a place where people come in, get assessed, and go to different floors or go home. So it's an entrance point for people to come into the hospital. And as a result, you definitely see different patients come in. And as a result of that, you definitely have different areas and subdivisions within an emergency department. And when I was working on the floor and when I was learning about nursing in nursing school, no one really told me what emergency nursing is about. So in this video, I really want to try and emphasize the different areas that you can work as an emergency room nurse and kind of show you the variety of different areas that you get to be working in within each shift. If you like the content of this video, I would greatly appreciate it if you give this video a thumbs up. And let me know what your thoughts are in the description box down below. Would you want to do emergency nursing? Is that some area that you're looking to pursue? I'd love to hear what you have to say. So now let's get on to the 6 different areas that you can be placed in the emergency department. Well, typically it's 5. So I'll explain that. The 6 different areas of the emergency department are triage, you get first aid, you get intake, acute, trauma, and medical surgical. Now, every emergency department is a bit different, but all of them typically have many, if not all, of those different subdivisions. And different emergency departments have different ways about seeing their patient come into the hospital. But typically in my hospital, what happens is you either get a patient that walks in or a patient that comes in through an ambulance. So when you first go in, you get seen by a triage nurse. Now, the triage nurse is one of the most experienced nurses in the emergency department because they're the first contact with the patient. You know, they have to be able to identify if their problem is really acute, if they need to see a doctor right away, or they can wait. And they do that by using what's called the Canadian Triage Acuity Scale, the CTAS score. So based on what the patient's complaints are, they identify what their CTAS score is and triage them to the appropriate places. Often when they triage them, they get automatically a set of orders for that patient when they go to wherever their place they're going. So for example, if someone is triaged as a CTAS 4, the place that they go to in the emergency department is first aid. And first aid is usually one registered nurse and typically a few LPNs. And the first aid department, or the first aid area of the emergency department, typically sees CTAS 4 level. So those are the people that are walking and they have, a broken finger. Sometimes they have a huge laceration that needs stitches, but they're overall doing very well. Their vital signs are stable and they don't really have a problem. Now, the next acuity level is a CTAS 2 to 3. CTAS 2 to 3 are going to be placed in intake. And intake, you have a lot more registered nurses. Those are patients that are typically going to, having their CT of their abdomen. They're having a CT angio. They have, depending on how the patient's doing and depending on the clinical judgment of the triage nurse, they can either be a CTAS 2 or 3. Typically, the patients there are CTAS 3 though. They should be able to walk and they should be able to, somewhat go about their business, but they do have some sort of problem or an impairment that's making their life uncomfortable, whether it's chest pain, whether it's nausea, whether it's vomiting, or whether it's a UTI. So that's where a CTAS 3 goes. Typically CTAS 2s get placed in an acute bed. So in the acute beds, you have patients that are, in an uncontrolled AFib, or, they have chest pain with cardiac markers that show that it's true cardiac related. They are people that have acute conditions of their diseases typically. So that could be a really bad pneumonia, that could be a really bad infection, it could be meningitis. It's things that require a lot more monitoring constantly from a nurse. The other two places that an emergency nurse can work is the medical surgical area and trauma. Now, in the medical surgical area, these are people that you typically have patients that have been assessed, have a diagnosis, but there's not enough beds upstairs, or we're waiting for a bit before they go upstairs just to make sure they're okay, or they just need more time because the person upstairs needs to be discharged before that person goes upstairs. So they get placed into the med-surg area, and they have a non-specialized nurse see those patients. Typically, it's not a emergency qualified nurse. It's a regular registered nurse with no other extra certifications, and that's because they tend to be not as acute as the emergency room nurse, or the nurses that the ER nurses have to take care of. Next, there is the trauma room. So the trauma room, those are people that come in with the ambulance. A lot of times you have the motor vehicle accidents, they have active chest pain, they have what's called a STEMI, or they have an acute stroke. Those are the patients that typically come into trauma. Or sometimes the acute beds have a patient that is decompensating so severely that it requires one-to-one observation. Those patients, if they go upstairs, are typically going to the ICU, or they are monitored for a prolonged period of time and they go back into the acute beds where they get monitored by an emerg nurse, and they go upstairs. So in the acute beds, there's 4 patients to 1 nurse. Sometimes there's 3 patients to 1 nurse, depending on which emergency department you work at. In intake, you don't really have a patient load. You just have to help as many people as you can while you're there. And it's a very busy place to work. The same thing goes for first aid. There's a lot of different people that come in, and you just have to help them as much as you can. Whereas acute, it's more 3-to-1 or 4-to-1 ratios, and trauma, it's either 2-to-2 or 1-to-1. Typically, it's 1-to-1 workload because that patient is so acute. So that's the emergency department. That's how it works. Now, if you're an emergency qualified nurse, what typically happens is you go, you sign into your shift, and there's a board that tells you where you get placed to work. So one day you could be working in intake, the other day you might be working in first aid, and the other day you might be working in acute. It kind of depends on what the staffing levels are, because if you're more experienced, like I mentioned in the beginning, a triage nurse goes to the more experienced nurses go to triage, and then the next they go on to the trauma room, and then it just varies. It doesn't really matter after that. But typically the most experienced nurses work triage and trauma because the patients are so acute and it's a sensitive area, and you really have to know what you're doing. And of course you have to know what you're doing on all the different segments of emergency department, but it requires a lot more experience because you need to be comfortable working in triage and trauma. Anyways, guys, I hope you liked this video. If you did, please consider giving it a thumbs up, and let me know if you're thinking about doing emergency nursing. I hope this video helped you decide. We'll catch you in the next video.